In preparation for the application of the CoFlex TLC kit, dress the wound with an appropriate primary dressing. Take the black piece of tape that is included in the box and position it to be readily accessible at the completion of layer 1. To begin wrapping, dorsal flex the foot or toes to the nose. When applying layer 1, place the blue side facing down against the skin and white side facing away. Avoid starting on the side or bottom of the foot to prevent possible slippage or pressure injuries. Starting at the top of the foot at the base of the 5th digit or pinky toe, continue along the base of the digits, angling while spiral wrapping around the foot. The size of the foot determines how many times you will spiral wrap. Now for the second step of layer 1. Proceed to the ankle and make one figure 8. Starting by going around the back of the ankle, continuing under the foot, stay close to the heel. Avoid going directly over the heel to prevent pressure injuries from possible folds in the foam. At this point, there may be a slight gap in the heel region. In the final step of layer 1, continue up the leg in a spiral fashion overlapping 50%. A correct 50% overlap can be indicated by a uniform shade of color. End the spiral wrap a 2-finger length under the bend of the knee for optimal comfort. Cut or hand tear layer 1 and secure in place with the previously prepared black tape. After completing layer 1, there may be extra product. Here are a few suggestions for use. Try running the extra foam layer up and down the shin for additional padding. If there are trouble areas with high drainage, fold the remaining product on itself and bolster the highly draining region. Finally, try using the extra product to build up the ankle area when patients present with a wide calf and slender ankle, also known as an inverted champagne leg. To begin wrapping layer 2, dorsal flex the foot or toes to the nose. When applying, start the cohesive in full stretch on the top of the foot at the base of the 5th digit or pinky toe. Continue along the base of the digits, angling while spiral wrapping around the foot. The size of the foot determines how many times you will spiral wrap. Now for the second step of layer 2. Proceed to the ankle and make 2 figure 8s. Start the first figure 8 by going around the back of the ankle, continuing under the foot, staying close to the heel. For the second figure 8, follow the same path around the ankle as before, then continue directly over the heel to enclose any gaps. Hold the cohesive roll by the core with one hand. Use the other free hand to guide and smooth out any wrinkles. Continue up the leg in a spiral fashion with a 50% overlap, pulling the cohesive out 6 to 8 inches before guiding it into place with the free hand and keeping an eye on the indicators. The consistent shape of the indicators will help provide restorative compression. Ending the spiral wrap 2 finger lengths behind the bend of the knee for optimal comfort, ensure that cohesive ends on cohesive. Cut or hand tear. Rub the end of the cohesive for a tight seal and hug the leg all the way down. To assure patient comfort and that the wrap is not too tight, confirm 1 finger space near the toes and knee. Included in every box is an extra large stocking that can be worn over the completed application of layer 1 and 2. When applying, pull the stocking seam away from the toes to help prevent irritation. This stocking will not increase compression and allows for ease of movement in everyday life.